Have you ever stopped and wondered if the very pills you take every single day, the ones you trust to keep you healthy, might actually be working against you? Imagine this: a quiet thief, slipping into your mind, stealing away pieces of your memory, and you don't even notice until it's too late. It sounds frightening, doesn't it? But the truth is, some of the most common medications sitting right now in your bathroom cabinet could be silently increasing your risk of dementia. In this video, we're going far beyond the labels on the bottle. We'll uncover for every day drugs that researchers have linked to memory loss, drugs that millions of people take daily without realizing the potential cost to their brain health. And here's the critical part. By the end of this video, you won't just know what these medications are. You'll also discover the hidden side effects, the science behind why they affect your memory, and most importantly, the practical steps you can take today to protect yourself and the people you love. Think about it for a second. What could be more important than safeguarding your mind? Your memories hold your life story, your first kiss, your proudest achievements, the faces of the people who matter most. To lose those memories isn't just inconvenient, it's like slowly losing yourself. That's why this information could genuinely change your life. So, I'm going to ask you to stick with me until the very end, because understanding these risks might just be the key to keeping your mind sharp, vibrant, and alive for many years to come. Before we dive in, let me quickly say this. If you find this video valuable, it would mean so much if you hit the like button. That simple action helps me keep creating content like this listens that can truly change lives as we age. And if you haven't subscribed yet, go ahead and hit that subscribe button and turn on the bell icon, so you don't miss any of the videos I have coming up. I'd also love to hear your feedback. If you like this video, comment 1. If not, comment 0. Your thoughts help me improve and create content that really serves you. Now, let's begin with the first and perhaps one of the most concerning categories: anticholinergic medications. Among all the drugs that scientists and doctors have connected to a higher risk of dementia in older adults, anticholinergic medications stand out as some of the most widespread and worrisome. These aren't rare or obscure drugs. They're prescribed all the time for conditions like allergies, an overactive bladder, insomnia, depression, and even gastrointestinal issues like irritable bowel syndrome. On the surface, they seem harmless, even helpful. They make you stop sneezing. They quiet those constant bathroom trips. They help you sleep when your mind won't settle down. They ease stomach cramping that interrupts your day. They promise relief, and for many people, they deliver. But beneath that surface lies a hidden mechanism, one that can directly interfere with your brain's ability to function at its best. Here's what's happening. These medications block a critical neurotransmitter in your brain called acetylcholine. Now, acetylcholine is absolutely essential. It's the chemical messenger that helps your brain cells talk to one another. It supports memory formation, learning, attention, and even your ability to solve problems. Without enough of it, the gears of your brain start to grind more slowly. Imagine trying to read a book with half the words missing, or walking into a room where the lights keep flickering on and off. That's the kind of disruption anticholinergic drugs can cause inside your brain. Even short-term use can bring on side effects: confusion, difficulty concentrating, forgetfulness, and sometimes even delirium. For younger people, those effects might pass quickly, almost like brain fog that eventually clears. But for older adults, especially anyone over 65, the impact can be far more serious. Why? Because as we age, our brains naturally become more vulnerable. Nerve cells are less resilient, repair mechanisms slow down, and pre-existing conditions, like mild cognitive impairment, make the risks even greater. And here's the alarming part. Research shows that long-term use of these medications isn't just a short bump in the road. It's strongly associated with accelerated cognitive decline and a significantly higher chance of developing dementia, including Alzheimer's disease. But the danger doesn't end there. One of the most troubling aspects of this issue is just how common these drugs are. Many patients and even many doctors don't always recognize the cumulative effect of anticholinergics. They're not just in prescriptions. They hide in over-the-counter remedies too. Allergy pills, cold medications, sleep aids. For example, diphenhydramine, which you probably know by its brand name Benadryl, is one of the most frequently used. Now imagine this. An older adult dealing with seasonal allergies takes an over-the-counter antihistamine. At the same time, they're also prescribed medication for bladder control. Both have anticholinergic properties. Taken separately, each one might seem harmless, but together, they build up what doctors call an anticholinergic burden. This is when multiple drugs with the same cognitive side effects stack on top of each other, creating a snowball effect. The result? A much greater risk to memory and brain function, often without any warning signs until the damage is already noticeable. Let me share with you the story of Eleanor, a 74-year-old retiree from Ohio. For years, Eleanor managed her seasonal allergies with an over-the-counter antihistamine. She also took a prescription for her overactive bladder. To her, these pills were just part of her routine, nothing unusual, nothing dangerous. They gave her relief and allowed her to enjoy life without constant discomfort, but slowly, almost imperceptibly, things began to change. Eleanor found herself forgetting names of people she'd known for years. She misplaced items around the house more often. She felt a persistent mental fog, a cloudiness she couldn't shake. She chalked it up to just getting older, something many of us might do. But during a routine medication review, a pharmacist noticed the red flag. Both of Eleanor's medications were anticholinergic, with her doctor's help. She switched to alternatives options with fewer cognitive risks, like antihistamines and bladder training techniques. Within a few months, Eleanor noticed a remarkable change. Her mind felt sharper, clearer. She had more focus and energy. It was as if a heavy curtain had been lifted. Eleanor's story is not just inspiring, it's a powerful reminder that the medications we rely on can have hidden consequences, and that adjusting them can make a profound difference. The challenge is this. So many people are unaware. Medications they've trusted for years, even decades, might be silently undermining their brain health. Over-the-counter products are especially deceptive because people assume that if you don't need a prescription, it must be safe, but that's not always the case. In older adults, whose bodies process drugs more slowly and whose brains are less resilient, even small doses can accumulate over time. The result is a subtle but dangerous erosion of memory and cognitive function. In the last section, we uncovered how anticholinergic medications, those seemingly harmless pills for allergies, bladder issues, or sleep, can quietly interfere with the brain's chemistry and sharply raise the risk of dementia. But the story doesn't stop there. In fact, the evidence only grows more alarming when we look at the research. Studies, including those published in highly respected journals like JAMA, Internal Medicine, have made the risks crystal clear. Exposure to strong anticholinergics can increase the risk of dementia by as much as 50% in certain populations. Just imagine that half again as likely to face memory loss simply because of a pill you may have been taking for years. This is not a small statistic. It's a red flag, especially for older adults who are already juggling multiple chronic conditions and often several different prescriptions at the same time. So what can be done? The answer is not to panic or stop treatment altogether, but to take proactive, informed steps. Seniors and really anyone on long-term medication should make it a habit to regularly review their full list of prescriptions and over-the-counter drugs with a healthcare professional. Ideally, that professional is someone who truly understands how these medications interact with the brain, like a geriatrician or a knowledgeable pharmacist. There are simple but powerful questions that every patient should ask. Do any of my current medications have anticholinergic properties? Are there safer alternatives for treating my condition? And are there non-drug approaches like lifestyle changes, therapy, or physical training that could help manage my symptoms just as effectively? The encouraging news is that, in many cases, the answer is yes, alternatives do exist. For instance, non-anticholinergic antihistamines can be swapped in for allergy relief. Bladder training techniques can reduce the need for overactive bladder drugs. Dietary adjustments often help with gastrointestinal issues. These options can provide meaningful relief without sacrificing cognitive health. The goal here is not to give up on necessary treatment. It's about making brain protective choices that balance symptom relief with long-term mental vitality. For some people, this might mean switching to medications that carry a lower anticholinergic burden. For others, it might mean reducing dosages under medical supervision or turning to non-pharmacological therapies like cognitive behavioral therapy, physical therapy, or structured lifestyle changes. The truth is, staying vigilant about side effects doesn't just prevent problems, it empowers older adults. It allows them to maintain clarity, independence, and a better quality of life. By fully understanding the risks that anticholinergic medications carry, and by actively seeking safer alternatives, seniors can take a critical step toward preserving their mental sharpness for years to come. And if you're still here, watching this video and finding value in what we're uncovering together, I'd love to know. Please comment the number 1 down below, just to let me know you're with me on this journey. Your time is precious, and I'm grateful you're spending it here with me. Now, let's turn to the second major category of medications that experts say we need to pay close attention to: sleep aids and sedatives. This is another class of drugs that neurologists frequently flag for their potential to increase dementia risk in older adults. The culprits here include benzodiazepines such as lorazepam and diazepines, stapimos, well as non-benzodiazepine hypnotics like zolpidem, which you might recognize by the brand name Ambien. These medications are often prescribed to treat insomnia, anxiety, or agitation conditions that, unfortunately, become more common as we age. In the short term, they can feel like lifesavers. They help people fall asleep when restless nights feel unbearable, or calm nerves when anxiety makes daily life overwhelming. But here's the catch. While they provide short-term relief, their prolonged use comes with serious risks to cognitive health. How do they work? Sleep aids and sedatives function by depressing the central nervous system, essentially slowing down brain activity to induce relaxation or sleep. In the moment, this feels soothing, but the brain depends on natural rhythms, periods of activity and rest to carry out vital functions like memory consolidation, emotional regulation, and problem solving. When these rhythms are artificially suppressed for too long, the brain's balance is disrupted. Over time, this can lead to troubling side effects: confusion, impaired memory, reduced focus, even disorientation. And the research backs this up. Studies published in journals like the BMJ have drawn strong connections between long-term use of benzodiazepines and other sedatives with cognitive decline and dementia. Some findings suggest an increased risk of Alzheimer's disease by as much as 50 to 80% among those who use these drugs for extended periods. Let's bring this down from the statistics to the human level. Take the case of Henry, a 78-year-old retired accountant from New York. After losing his wife, Henry struggled with relentless insomnia. Night after night, he lay awake, exhausted but unable to rest. His doctor prescribed a benzodiazepine. At first, it was life-changing. Finally, Henry slept through the night. But months later, his family began to notice unsettling changes. He forgot conversations they'd had only hours before. He seemed distracted, sometimes even disoriented in his own home. Tasks he once handled effortlessly, like managing his finances, suddenly became overwhelming. Concerned, his daughter accompanied him to a follow-up visit. After reviewing his medications, the doctor recognized the warning signs. Use of benzodiazepines was taking a toll on Henry's cognition. The solution wasn't easy, but it was effective. With careful medical guidance, Henry began tapering off the drug. His doctor introduced non-drug alternatives, like cognitive behavioral therapy for insomnia (CBTI), along with healthier sleep habits, a consistent bedtime routine, less caffeine, and a calming pre-sleep environment. Over time, Henry's mental clarity began to return. His focus improved, and he reported feeling more present and engaged during the day. Henry's journey highlights the importance of vigilance. Sleep aids and sedatives are widely used among older adults because insomnia and anxiety can drastically reduce quality of life. For doctors, prescribing these drugs often feels like the fastest, most effective solution. But here's the problem: the long-term risks are rarely emphasized. Too many seniors continue on these medications for months, or even years without proper reassessment, and there's another factor at play: aging itself. As the body grows older, the liver and kidneys metabolize drugs more slowly. That means these medications linger longer in the system, intensifying both their intended effects and their side effects. This not only heightens the risk of memory impairment, but also increases physical dangers such as dizziness, falls, and fractures, threats that can severely compromise independence and overall well-being. In the last section, we saw how sleep aids and sedatives, though often prescribed to bring comfort and rest, can quietly create a dangerous trap, blurring memory, slowing focus, and even increasing the risk of falls or injuries. Now let's look closer at how these risks connect, and then turn our attention to another important group of medications you need to know about. The truth is, the interplay between cognitive and physical risks can create a vicious cycle. Take this example: an older adult who uses a sedative at night might wake up the next morning feeling unusually drowsy or unsteady. That lingering grogginess increases the likelihood of tripping, stumbling, or even experiencing a serious fall. An injury from a fall doesn't just limit mobility. It often reduces social engagement to Kenda. As we know, isolation and reduced activity are themselves powerful contributors to cognitive decline. It becomes a downward spiral, one problem feeding into another. On top of this, dependence on sleep aids can quietly develop over time. What starts as an occasional solution can turn into something your body and mind struggle to give up. Discontinuing these medications suddenly can be difficult and even unsafe without professional guidance, leaving many older adults feeling trapped between poor sleep and mounting cognitive risks. The good news is that alternatives exist, and many of them are surprisingly effective. Options like cognitive behavioral therapy for insomnia, CBTI, mindfulness practices, or simple environmental changes can make a world of difference. For example, reducing screen time before bed, adjusting the bedroom to be darker and cooler, or establishing a calming bedtime routine can all help the body naturally prepare for sleep. These methods may not work overnight, but with consistency, they often restore healthy sleep patterns without the risks tied to SEDATIVS. To protect brain health, it's crucial for older adults and their caregivers to have honest, proactive conversations with healthcare providers. Important questions to bring up include: how long should I safely take this medication? What are the cognitive risks if I continue using it? Are there non-drug strategies that might help manage my sleep or anxiety instead? And here's something vital to remember: tapering off these medications, when appropriate, should always be done under medical supervision. Abrupt withdrawal can lead to distressing symptoms, but a gradual, guided approach often makes the transition smoother and safer. Sometimes even small lifestyle adjustments can produce powerful results. Avoiding heavy meals late in the evening, practicing relaxation techniques like deep breathing or gentle stretching, or engaging in light physical activity during the day can significantly improve sleep quality without relying on pills. The core message here is simple but essential. While sleep aids and sedatives can bring temporary relief, their long-term use may carry hidden dangers that outweigh the benefits. By prioritizing brain health and exploring safer alternatives, seniors can achieve not only restful sleep and emotional calm, but also protect their mental sharpness for the future. Making informed decisions about these medications is not just about getting a good night's rest, it's about preserving vibrant, engaged days, filled with clear thinking and cherished memories. And if you're still here, still finding these insights valuable, I'd love to know. Please comment the number 2 below, tells me you're engaged and learning right alongside me. Your support makes it possible for me to keep bringing you this kind of content. And don't forget, if you want more insights like these, consider subscribing and turning on notifications, so you never miss an update now. Let's move on to the third category of medications linked to cognitive risks: certain antidepressants. When we talk about drugs that affect brain function, antidepressants are often the first to come to mind. Their role in mental health treatment is undeniable. For millions of people around the world, they are life-changing, helping to relieve symptoms of depression, anxiety, obsessive-compulsive disorder, and other conditions. But for seniors, the choice of antidepressant requires special care. In particular, the older generation of antidepressants known as tricyclic antidepressants, TCAs, medications like amitriptyline, nortriptyline, or imipramine have been associated with a greater risk of cognitive decline and even dementia when used over extended periods. How do they work? Tricyclic antidepressants act by modulating the brain's neurotransmitters, chemical messengers such as serotonin, norepinephrine, and dopamine. These chemicals play critical roles in regulating mood, sleep, and cognitive processes. By stabilizing these chemicals, TCAs can improve mood and emotional well-being. But here's the trade-off. The same mechanism that helps with depression can also interfere with cognitive function, particularly in older adults, whose brains are more sensitive to chemical imbalances. The side effects can be subtle but significant. Memory lapses, difficulty concentrating, confusion, or slowed reaction times are not uncommon. What makes it tricky is that these symptoms often mimic normal aging or can even look like early dementia. In some cases, the medications themselves may accelerate cognitive decline, creating a confusing and stressful situation for patients and families alike. Consider the story of Linda, a 69-year-old retired nurse from Colorado Springs. After losing her husband of 45 years, Linda fell into deep grief and was diagnosed with major depressive disorder. Her doctor prescribed a tricyclic antidepressant, a medication she had once taken in her younger years without problems. At first it seemed to help. Her mood lifted just enough for her to get through the day. But as the months turned into years, troubling changes began to surface. Linda started forgetting appointments. She struggled to recall familiar names and found herself losing track of conversations she used to follow easily. Her family grew concerned, fearing the onset of dementia, and urged her to seek another opinion. A neurologist, working together with a psychiatrist, carefully reviewed her case. What they found was eye-opening. The tricyclic antidepressant she had been taking for years could very well be contributing to her cognitive decline. With close medical supervision, Linda gradually transitioned to a newer class of antidepressants, serotonin reuptake inhibitors, SSRIs. These medications are widely regarded as having a lower risk of cognitive side effects. And for Linda, the difference was profound. After months of careful adjustments, her mind began to clear, her focus sharpened, and little by little, she reclaimed the confidence she once had in her daily routines. This turning point reveals something crucial that often goes unnoticed. The very medications meant to heal can sometimes place an invisible burden on cognitive health. Many older adults, for example, are prescribed tricyclic antidepressants, or TCAs. Doctors reach for these drugs because they have been around for decades, are widely available, and are usually more affordable than newer options such as SSRIs or SNR, is serotonin or norepinephrine reuptake inhibitors. On paper, TCAs seem practical, but when we look deeper, especially in the context of brain health and aging, the hidden costs become harder to ignore. Why? Because research has repeatedly shown a troubling pattern. Studies published in respected journals such as The Lancet and JAMA Neurology point to a link between long-term use of antidepressants with strong anticholinergic effects, like many TCAs, and a higher risk of dementia. The reason lies in how these drugs work. Anticholinergic medications block acetylcholine, a neurotransmitter that plays a vital role in learning and memory. Imagine cutting the power to a city's streetlights. Without that guidance, confusion spreads. In much the same way, blocking acetylcholine can dim the brain's ability to process and retain information. This delicate balance between treating depression and protecting cognitive health is especially important for seniors. Depression itself is already recognized as a risk factor for cognitive decline. Left untreated, it can worsen memory lapses, blur concentration, or even mimic the early signs of dementia. So the question is not whether antidepressants should be avoided altogether, but rather, which treatments can offer emotional relief while still safeguarding the mind. That's why many physicians prefer prescribing SSRIs such as sertraline or escitalopram for older adults. These medications generally have a gentler side effect profile and are less likely to compromise cognitive performance. Beyond medication, there are also non-pharmacological approaches worth considering: cognitive behavioral therapy, mindfulness practices, support groups, or even structured daily routines that provide mental stimulation and emotional grounding. These methods may not replace medication in every case, but they can complement treatment and sometimes reduce the overall need for drugs. Still, one golden rule must never be overlooked. Any change in antidepressant use, whether adjusting the dose, switching prescriptions, or discontinuing completely, should only happen under close medical supervision. Stopping abruptly can unleash withdrawal symptoms, worsen depression, or trigger serious complications. For seniors and caregivers, the safest path forward is open. Ongoing dialogue with healthcare providers. Important questions to ask include: are there alternatives with fewer cognitive risks? Can therapy or lifestyle adjustments help ease symptoms? Could physical activity or dietary changes support emotional resilience? Staying informed, asking these questions, and being proactive allows individuals and families to advocate for both mental and cognitive health. The truth is, the connection between antidepressants and dementia risk remains complex and not fully understood. But with each new study, we gain more clarity. And with clarity comes empowerment. Ultimately, the goal of aging well is not just to extend years, but to protect both the heart and the mind. With thoughtful planning, medical guidance, and a willingness to adapt, seniors can embrace a future that is both emotionally fulfilling and mentally vibrant. And yet, antidepressants are only one part of the picture. There's another hidden risk that often slips under the radar: the over-the-counter nighttime pain relievers many seniors rely on. These PM formulas like Tylenol PM or Advil PM promise relief from both aches and sleepless nights. But behind their soothing promise lies another potential danger for the aging brain. Just as antidepressants can quietly affect memory, over-the-counter medications can pose hidden risks too. And one powerful reminder of this comes from Joe's story. Joe had begun to feel disoriented even in places that should have been second nature to him, like his neighborhood grocery store. What once felt familiar now seemed strange, and his daughter grew deeply concerned. Fearing the early signs of Alzheimer's disease, she decided to accompany him to a geriatrician for a full evaluation. The doctor took time to carefully review Joe's daily habits, his medical history, and especially his list of medications. That's when the culprit came into focus. Joe had been relying heavily on PM pain relievers, products containing these medications, marketed as a way to ease both pain and sleeplessness, were quietly undermining his cognitive health. Under the doctor's guidance, Joe began a slow and steady taper, replacing those sedating formulas with safer alternatives: non-sedating pain relievers, relaxation techniques, and a consistent bedtime routine. The changes didn't happen overnight, but within a few months, his family noticed real improvements. His memory sharpened, his thinking became clearer, and the fog that once clouded his daily life began to lift. Yet some lingering effects served as a sobering reminder: when it comes to brain health, early intervention truly matters. So why are these PM medications particularly dangerous? Their accessibility: unlike prescription drugs, which require a doctor's approval, PM pain relievers can be found everywhere from the corner pharmacy to the grocery aisle, even ordered online with a few clicks. Because they're so easy to buy, many people assume they're completely safe for frequent use. But studies, including those published in JAMA Internal Medicine, tell a different story. They reveal that long-term use of anticholinergic medications such as diphenhydramine is linked to a significantly higher risk of dementia. The science behind this is clear. As the brain ages, it becomes less efficient at clearing out these compounds. Instead, they build up and exert longer, more disruptive effects on memory and cognition. And the danger doesn't always stop with a single medication. Many seniors unintentionally combine several anticholinergic drugs, perhaps a PM pain reliever at night, an allergy pill during the day, and a prescription for something else, without realizing the risks are multiplying with each dose. One of the biggest challenges here is awareness. Far too many seniors and caregivers simply don't know that the active ingredients in PM formulas can affect brain health so profoundly. Labels tend to highlight the benefits: better sleep or gentle pain relief, but often fail to warn clearly about the potential long-term cognitive side effects. Unless someone digs deeper or speaks directly with a healthcare provider, these risks remain hidden in plain sight. That's where pharmacists and doctors play a crucial role. They can help bridge the gap by educating patients and encouraging safer choices. Still, individuals and families must also take responsibility, reading medication labels carefully, looking out for ingredients like diphenhydramine or doxylamine, and asking questions before making something a daily habit can go a long way toward prevention. Thankfully, safer options exist. For pain medications like regular acetaminophen or ibuprofen taken under proper medical guidance can provide relief without clouding the mind. For sleep, non-drug approaches are often surprisingly effective. Cognitive behavioral therapy for insomnia (CBTI), progressive muscle relaxation, or simply creating a calming sleep-friendly environment can make a profound difference. Even gentle practices like yoga, tai chi, or stretching can help manage chronic pain and improve sleep quality, all without the risks of sedating medications. Caregivers and family members also hold an important role. By staying observant, noticing early signs of memory changes, and regularly discussing medication used with healthcare providers, they can help protect their loved ones' cognitive health. Because ultimately, safeguarding the mind as we age requires a proactive mindset, not just about prescriptions, but about every pill and product we bring into our homes. Over-the-counter doesn't always mean risk-free. These drugs may be convenient, but their hidden dangers can accumulate over time. By staying informed, asking the right questions, and embracing safer alternatives, seniors can preserve their mental clarity and continue enjoying a high quality of life. Knowledge is power, and one of the most powerful ways to protect both body and brain is by paying close attention to what we put inside them. If you found this information eye-opening, please consider liking, sharing, and subscribing so you don't miss future health insights. Your support helps us keep creating content that empowers and informs. And if you're still here with us, drop the number 4 in the comments. It lets me know you're engaged and learning right alongside this community. That wraps up our deep dive into the shocking truth about 4 common medications linked to memory loss and dementia risk. Now, I want to hear from you. What's one key thing from today's video that made you stop and think about your own health? Maybe it's a medication you'll ask your doctor about, or a new step you'll take to protect your brain. Share your thoughts below. We learn best when we learn together. Stay informed, stay healthy, and as always, we'll see you in the next video.